Good morning, students. Can you hear me?
Yes, sir.
Sir, yeah, fine.
Yes, sir.
Yeah, fine. I
Yes,
am
sir.
Dr.
Good
Raghavendra
morning,
K.
sir.
Good morning, good morning. Yeah, I am from the Department of Pediatrics and I will be teaching you about collaborative learning. I think Dr. Shubha has already taught you about it, but how to apply collaborative learning in the clinical side, I will be teaching you. Am I audible?
Yes, sir.
Yes,
Yes,
sir.
sir.
Yeah, fine. Yeah, fine, fine. So, what are the usual methods which we have been traditionally using in medical curriculum to teach you people? So, because you have not been to the college, this picture is new to you. So, you will be sitting in one such hall and the person standing there will be giving a lecture to you. This is the normal didactic lecture you will be facing. And there will be a few practical classes where a teacher teaches you in small groups. You see, it is a bit different here. That was a huge, large group, you could not ask any questions. Here you can ask questions when you have a doubt. For example, here it is an osteology class where the anatomist is teaching you about bones. And this is a clinical class. So, here the teacher is demonstrating certain findings in a patient to a small group of students. Now, you saw all the three traditional methods of teaching. What was the common thing you found here? Could you tell me? Anybody? So, what was common in all these three things? Nobody.
Group learning.
So, yeah, group learning is there, but something else is common.
A teacher is teaching and the students are listening to it.
Listening, excellent. So, that is the point. What is happening here in all these three groups, there was a big group, there was a small group and there is a still smaller group, but the students are standing there and listening and the teacher is teaching. It is a teacher centered approach what has been happening here. What are the students doing here? They are not asking any questions, they are being very passive. So, when something like this happens, you have any Kannadigas here? You can understand Kannada? Borgal mele neer suridante. So, the teacher is pouring water on a rock. The rock may absorb or may not absorb, depends on the type of rock, but usually they do not absorb. So, a teacher centered class usually is a waste. What is required for learning is not how well the teacher can teach, it is about a motivated student. The student should have a desire to learn. Now, you have come to MBBS, you should be hungry for knowledge regarding the human body, how it functions normally, then how it functions when abnormal. That hunger is required, the extreme desire to learn is important. And you should be learning not to become a famous doctor or a doctor who is very rich to get the acclaim of your peers, no. The desire to learn should be because you find learning as fun. So, once a student has this desire to learn, then learning is meaningful. See, a student should not be a rock, he should be a sponge. Wherever knowledge is there, the sponge, just like it absorbs water, you should be able to take in knowledge. So, self-learning, whatever the teacher teaches will be a waste, because we have seen that happening over the years. We take a class, everybody is very happy, they think they have understood, and after 1 week you ask, not a single thing comes out, because memory is so feeble, it does not sit there. For 2 days you feel you remember something, by 7th day you have forgotten everything. So, unless you are motivated and you have decided to dedicate your life for learning, you cannot. So, self-learning becomes very important. So, in order to learn something, you need to be exposed to the subject. You should be, for example, you want to learn about hypothyroidism, you should be exposed to the subject. So, there are two common methods by which you are exposed. One is by listening to lectures, second one is by reading from textbooks. This just exposes you to the subject. Why am I telling this? Because most of us listen to our teachers, go home and read from the books. That does not lead to deep learning. You have to add on something else like imagination. For example, if you are reading about jaundice, once you have read the topic and listened to an online lecture from a teacher, you should ask yourself these questions. Imagine yourself encountering a patient. Just imagine a hospital where you have gone to the hospital as a doctor and a patient has come. What symptoms might the patient present with? Will I be able to recognize jaundice? Where will I look for jaundice? Will I be able to do appropriate investigations, tests, blood tests for jaundice? And will I be able to write a proper prescription for that as a part of treatment? Now, once you ask these questions, then think from whatever you have read and listened, are you able to answer these questions? If you are not able, again go back to the textbook and start reading with a new intention. So, reading has to be in such a way that you want to correlate it with real life situations. So, that needs imagination. Just a minute. Yeah. And next, you have to make notes. You have to make very interesting notes. If you just keep on writing lines and lines and lines and pages, it becomes another smaller version of the textbook. No, whatever you learn, make it interesting. So, you can and list out all the signs and symptoms on the different parts of the body. This is how you are going to make interesting notes. And then for evaluation, for example, when you have a disease, there are different possibilities. You will have to evaluate as for the different causes of the particular symptom. Jaundice has got lot of causes. So, you should make simple flow charts in your notebooks, so that you will be able to remember the method of evaluation. And most importantly, you should be revising again and again. So, when you listen to a lecture, go home and read, your job is not done. Make good notes and keep on revising. But still, you keep on forgetting. This is because you learnt a lot of things, but you did not teach the topic to somebody. You did not discuss it with your friends. So, whatever you do, unless you teach it to some people, you are not going to learn it, so that it does not go into the long term memory. You are going to forget it, say, in a matter of months. You see, in this huge class where so many medical students are sitting and one person is teaching, who do you think is learning here? It is only the teacher who is learning, not the students, because in next week they will be forgetting it. The teacher, because he teaches, he learns again and again. So, unless you teach what you have learned to somebody, there is no way you are going to retain it. So, here collaborative learning comes into the picture. I mean, you can't make all your teachers sit there and give a lecture to them. There are 100 students, right? So, you form small groups and you keep on discussing things among yourself and teaching each other. That is one way by which you consolidate your learning. So, let us begin with an example. This is from the clinical side. Usually, when a person comes to us with fever, cough and difficulty in breathing, we think there is an involvement of the respiratory system. So, there is a technique for examining the respiratory system. So, how do we learn this technique? By the collaborative learning method. First, suppose I want to take a class on respiratory system examination. The first thing I do is I will give them, which there is one book called as Hutchison's Clinical Methods, where you will be given detailed description as to how to examine the respiratory system. That is not enough. I will also give you a video, and seeing that video you will be able to learn the different skills for examining the respiratory system. So, you read from the book and you listen to the, you see the video. Students form groups of 5 now. So, 5 students, because usually in a clinical posting we have got 25 students per batch. So, we will be forming 5 groups and the topic is split up among these 5 groups. For example, one group will learn about how to take a proper history in a patient with respiratory system involvement. One person will talk about inspection, palpation, percussion and auscultation. Do not worry about what these things are, you will learn later. So, we split up the same one chunk into 5 bits and give it to the 5 groups. Now, the students go back, sit and read and learn, and then they start discussing among themselves, they start practicing among themselves. So, when you do this, you not only are learning the subject, but you are also learning the interpersonal skills, you are learning how to communicate with other people, and one person takes the role of a leadership. So, you learn how to be a leader and you learn how to get involved in a group and obey the group rules. And then you come back to the hospital, you might practice on a mannequin. See, this is a doll which is used in our hospital settings, where before trying it out on the patient you can practice on a mannequin. So, you can practice those skills on a mannequin, you can try it out on a real patient, and in 1 week time, after having done all these things, you feel you have learnt well about the respiratory system examination. Now, you practice or you show your skills in front of a facilitator. So, in the front of the group you demonstrate the skills of history taking and physical examination, and when you do this, your friends will be giving inputs to you. No, that is not how it is supposed to be done, you have to keep your finger like this. The facilitator will be giving inputs to you. So, rather than making everybody sit and talking and talking and talking, the teacher here gives them the topic, they learn and come and demonstrate, and we just make corrections. So, this is a better way of learning. And finally, the examination will be in the form of OSCE. So, at the end of your clinical postings, we can evaluate you by this method, where a small part of the skill can be tested by different teachers. This is a second way of doing our collaborative learning, flipped clinics. Here what we do is, now we have learnt all the clinical skills as to how to examine a patient. Now, to go for the next order of learning, you are given a history, a case history, and you are also given clinical examination findings 1 week prior to the class. So, you go through those historical aspects and examination details. So, now you come to know what could be the probable disease the patient is suffering from. For example, a patient who is suffering from acute glomerulonephritis, it is a disease which affects the kidneys. So, the students, they take those sheets containing the history and examination findings and they analyze among themselves. They form a group and they start analyzing. Once they start analyzing, they come to know that they do not know much about the particular symptom. So, they go home and start reading from textbooks and again come back and analyze, and they try to find out what is wrong with the patient. Here the teacher does not come into the picture. You see, he does not tell you, okay, this is a case of glomerulonephritis. You are just given symptoms and you have to find out what is wrong with the patient. So, they consider, okay, what sort of tests I am going to do and what treatment shall I give. So, the students discuss among themselves, read from the books, again discuss. So, they are churning the matter among themselves, and finally, on the day of the class, the facilitator is there and they come and the facilitator starts asking questions. So, what do you think is wrong with the patient? And they come up with the possibilities which they have thought of, and the facilitator will be just guiding them and helping them understand. So, this method of teaching, where you discuss a case among yourself and come up with answers, helps in learning the skills of discussion, synthesis and analysis. And there is one more way by which we can do it in our clinical side. It is called as interactive role playing. You see, it is not just examining a patient and making a big diagnosis and writing a treatment. Most often, there is a method by which you are supposed to talk to the patients. The child or the adult might have a very serious illness, he might be dying in a few days. Now, how are you going to break that news to these parents? So, it needs a lot of skill. You can't directly go there and practice it in front of a patient. So, interactive role playing. So, one of the friends is asked to take the role of a patient or the role of a caretaker like the father or the mother, and you are going to break the news in a controlled setting. So, here one person becomes the patient, another becomes the consultant, duty doctor, nurse, and one of the student acts like a ward boy. So, what are they supposed to do? Some of these things can be practiced in the skill lab here, in the simulation lab. For example, somebody has a myocardial infarction, what are you going to do? Each one has a different role. So, you come together and practice that. Now, you switch roles. Now, who was a consultant becomes a ward boy now. Again you practice, you keep on practicing, so that you come to know what each person plays in a situation. Similarly, counseling sessions can also be practiced in this way. Once you practice and your teacher guides you, no, that is not how you are supposed to speak, break it in this way. So, the moment you start picking those skills, then you are allowed to talk to a live patient. This is what I have been trying to tell you. Student play a role of the father, mother, and a counselor. So, these are different methods by which we can use collaborative learning in our clinical setting. Still it is a bit far off for you, but it is good if you are aware of these methods. So, once you come to the hospital, you will be visiting our hospital there, and we will be teaching more to you. So, welcome to this institution. If you have any doubts, you can ask, or when you come to the hospital, definitely we will be there to clear the doubts. Anybody has any doubts, any questions? Everybody is sleeping?
No, sir.
No, sir. No, sir.
No, sir.
So, any clarifications? So, it is like we are teaching you how to drive a car before you have even seen a car. That is the problem here. I think the first step is you have to come here, see the hospital, the patients, and then your mind starts working, and then you start getting doubts, and we will be there to clarify. Okay. So, I think because of this COVID situations, these are necessary. That is why we are doing this. So, shall we go to the next lecture?
Yes, sir.
Okay, fine. Fine. Thank you. Thanks a lot.
Thank you, sir.
Thank you, sir.
Thank you,
Thank
sir.
you, sir.
Thank you, sir.
Fine.
Thank you, sir.
Fine. Thank you.